After turning 60, you start to notice changes in your body. An ache here, a dizzy spell there. Most of the time, it's nothing serious. But sometimes, those little changes are trying to tell you something. As a physician, I've seen it too often. A patient ignores the warning signs, and a stroke follows just weeks later. What if I told you that your body can actually signal a stroke, not just minutes before, but up to a month in advance? In today's video, I'll walk you through 7 early warning signs of a stroke that many seniors overlook. Some are subtle, some are surprising. All of them are serious. So stay with me until the end. And don't forget to hit subscribe, because the next video you watch could protect your life or someone you love. Now let's start with the #1 most ignored stroke trigger in older adults, and why it's more dangerous than you think. Sign number 1. Silent high blood pressure. Most people think they'll feel it when something's wrong with their heart or brain. But the truth is, high blood pressure rarely causes symptoms until it's too late. That's what makes it so dangerous. We call it the silent killer for a reason. You see, blood pressure measures how forcefully your blood pushes against the walls of your arteries. Over time, if that pressure stays high, it starts to wear down those arteries, causing tiny tears, scarring, even blockages. And when those damaged arteries are in your brain, the risk becomes very real. Either a blood vessel bursts, leading to a hemorrhagic stroke, or a clot forms, blocking blood flow, what we call an ischemic stroke. Now here's the part most people miss. You don't have to feel dizzy or lightheaded or tired. You can feel completely fine, while your blood pressure quietly climbs into the danger zone. Let me tell you about Mr. Allen. He was 68, active, no major complaints. But during a routine checkup, his blood pressure was 160/95. I advised him to monitor it closely, maybe start medication. He said, "Doc, I feel great. I'll just walk more and eat a little better." 3 weeks later, he was rushed to the ER after a minor stroke. Luckily, we caught it early, and he recovered well. But not everyone is that lucky. That's why I urge you, don't wait to feel a problem. Look at the numbers. Blood pressure that stays consistently above 130/80 needs attention, especially after 60. Lifestyle changes like reducing salt, staying active, managing stress, and taking your medications as prescribed can dramatically reduce your risk. Have you checked your blood pressure this month? And if so, did you take the numbers seriously? Even small steps today can help you prevent something life-changing tomorrow. Now let's move on to the next sign, one that may feel familiar but is far too often dismissed. Sign number 2. Persistent, unexplained fatigue. We all get tired now and then, after a long walk, a late night, or a stressful week. That kind of fatigue usually fades with rest. But what if you're feeling drained day after day, even when you're not doing much? No stress, no activity. Yet it feels like someone pulled the plug on your energy. That's not just normal aging. It could be a warning sign from your brain. As a physician, I've seen this pattern too often. An older adult starts feeling unusually tired, maybe even taking naps they never used to need. Their blood work looks fine. Heart checks come back normal. But deep inside, something else is happening. Fatigue like this, persistent, unexplained, can sometimes be the first sign of reduced blood flow to the brain. In fact, in some cases, it's linked to what we call a transient ischemic attack, or TIA. That's a mini-stroke. It happens when a small clot temporarily blocks a blood vessel in the brain. The blockage may last just a few minutes or hours, and the person often returns to normal without even knowing something happened. But here's the danger. A TIA is often a rehearsal for a full stroke. One patient I remember, Mrs. Daniels, 72, came in complaining that she just couldn't shake the fog. No pain, no dizziness, just deep, unrelenting fatigue. We ran some scans and found signs of a TIA that had quietly resolved on its own. She never even knew it had occurred. The body has a way of whispering before it screams. Ignoring those whispers is one of the biggest mistakes I see. So if you've been feeling drained for days or weeks, and you can't explain it, don't chalk it up to age. It might be your brain telling you that something is off. Talk to your doctor. Ask about your circulation. Push for answers. Because the next time it happens, it might not be so quiet. Let's keep going. The next warning sign might show up not in your energy, but in your eyesight. Sign number 3. Sudden vision problems. Your eyes aren't just windows to the world. They're also windows into your brain. That's why sudden vision problems can be far more serious than needing a new pair of glasses. In fact, they can be one of the earliest signs that blood flow to your brain has been disrupted. Let me explain. Your vision depends on a complex network of nerves and blood vessels, many of which are directly tied to the brain. When a stroke is developing, especially an ischemic stroke, it can quietly begin by blocking one of those vessels, cutting off the oxygen supply to areas responsible for processing what you see. The result? You might suddenly experience blurred vision, double vision, or even temporary vision loss in one eye. You might feel like you're having trouble focusing, or like your depth perception is off. Many people dismiss these symptoms. They assume it's dry eyes, eye strain, or just getting older. But in my practice, I've seen patients who lost part of their vision for a few minutes, only to have it return. And they didn't think twice about it. That's a red flag. There's a condition called amaurosis fugax, temporary blindness in one eye due to a blocked artery. It often precedes a stroke. And it's not just rare cases. Even subtle, momentary changes in your eyesight can indicate a TIA, or developing blockage in the brain. One of my patients, Mr. Rivera, age 74, was reading the paper when half the page seemed to fade away. It lasted maybe 10 seconds, then cleared up. He thought it was his glasses. 2 days later, he had a full stroke affecting his right side. Fortunately, he got care quickly and recovered well. But it was a close call, and one that could have been avoided. So, if your eyesight suddenly changes, even if it gets better, don't wait. It's not just your eyes. It could be your brain calling for help. If this is helpful so far, don't forget to subscribe for more senior health tips like this one. And speaking of the brain, the next sign isn't about what you see. It's about a kind of pain you never forget. Let's talk about severe, sudden headaches. Sign number 4, thunderclap headaches. Not all headaches are created equal. Some are dull and annoying, others come with stress or lack of sleep. But there's one kind of headache that should never, ever be ignored. The kind that hits you like lightning. We call it a thunderclap headache. It's sudden, it's severe, and in many cases it's a warning sign of a bleeding stroke or a ruptured brain aneurysm. I've had patients tell me it felt like an explosion or a firecracker going off inside my skull. Others describe it as the worst pain they've ever experienced. This isn't just a bad migraine, it's a possible emergency, and every minute matters. When a blood vessel in the brain ruptures, it spills blood into areas that are incredibly sensitive. That sudden pressure inside the skull can cause excruciating pain, confusion, vomiting, even unconsciousness. And while it sounds extreme, it can happen without warning, especially in older adults with high blood pressure or a family history of aneurysms. I'll never forget a patient named Lorraine. She was 73, active, and sharp as a tack. One morning over breakfast, she clutched her head, said, "Something feels wrong," and collapsed moments later. At the hospital, scans showed a ruptured aneurysm. We got to her just in time. Not everyone is that fortunate. Sometimes there are smaller warning headaches in the days or weeks before the big one. These may feel like sharp, brief pains behind the eyes or at the back of the head. Many people ignore them. But here's the truth. If a headache comes on suddenly and severely, unlike anything you've had before, don't wait. Don't take a pill and lie down. Don't assume it's just stress or dehydration. Go to the emergency room. The brain doesn't play games. When it's under threat, it sounds the alarm fast and loud. And once the damage is done, it's hard to undo. So if you ever feel a sudden, severe headache that stops you in your tracks, listen to your body. It could be your only chance to act. Now, let's look at the next sign, one of the most well-known but still often ignored. It starts with a loss of control in your arm, leg, or even your face. Sign number 5, numbness or weakness on one side. This is one of the classic signs of a stroke, and yet people still hesitate or wait too long when it appears. Sudden weakness, tingling, or numbness in your arm, leg, or face, especially on one side of the body, is a major red flag. It tells us that a part of your brain is no longer getting enough oxygen-rich blood. And when that happens, neurons start to shut down. Fast. You may feel like your arm won't lift properly, or one leg drags when you walk. You might even look in the mirror and notice your smile is crooked, one side of your face not quite moving like the other. Even if these symptoms go away after a few minutes, you should never ignore them. Why? Because that's exactly how a transient ischemic attack, or TIA, behaves. A TIA is sometimes called a mini-stroke. But don't let that term fool you. There's nothing small about it. It's your body's final warning before a major stroke strikes. And if you act quickly during a TIA, you may have a chance to prevent permanent damage, or even save your life. I remember a man named Harold, 71, who came to me after a strange episode at dinner. He reached for his fork and suddenly dropped it. His hand felt tingly, and he had trouble gripping anything for about 5 minutes. Then, just like that, it passed. His wife urged him to get checked, and thank goodness she did. We found signs of a TIA, and he began treatment immediately. He never had a full stroke because he took that warning seriously. Sadly, many others don't. They blame it on sleeping wrong, arthritis, or nerves. They wait for it to happen again. And when it does, it's worse. So if you ever experience sudden numbness, weakness, or tingling in one arm, leg, or side of your face, even if it disappears, don't wait. Call emergency services. Get to the hospital. Time is brain. Next, let's talk about something equally critical. When the brain's language center begins to falter. Sign number 6, slurred speech or trouble. Understanding. When most people think of a stroke, they picture weakness in the arms or face. But one of the most telling, and often overlooked, signs lies in your ability to speak or understand. If you suddenly find yourself struggling to get the right words out, speaking in slurred or jumbled sentences, or unable to follow what someone else is saying, your brain may be under serious stress. This isn't just forgetfulness or a moment of confusion. It could be aphasia, a condition where your brain struggles to form or understand words clearly. I've seen this symptom dismissed far too often, especially among older adults. Someone fumbles for words and family members think, "Oh, that's just a senior moment," but it's not. Let me share a story. A woman named Carol, age 76, was having coffee with her daughter when she suddenly stopped mid-sentence. She opened her mouth to speak, but the words wouldn't come out. When she finally spoke, her voice was slurred and confused. Her daughter thought she was joking at first. By the time she realized something was wrong, valuable minutes had already passed. Carol was having a stroke. Fortunately, she survived. But she later told me, "I knew what I wanted to say. I just couldn't say it. It was terrifying." Language is one of the brain's most delicate systems, and when it fails, even briefly, it's not something to ignore. If you, or someone near you, start speaking strangely, repeating words, slurring sentences, or responding in ways that don't make sense, even for just a few moments, get medical help immediately. Try this quick test. Ask the person to repeat a simple sentence like, "Today is a sunny day." If they can't, don't wait, because when your words disappear, your time might be running out too. Now, there's one final sign I want to share, and it's one that often gets brushed off as just feeling off. Let's talk about balance issues, nausea, and sudden mental fog. Sign number 7. Loss of balance, nausea, or foggy thinking. Sometimes, a stroke doesn't begin with dramatic symptoms like slurred speech or facial drooping. Sometimes it starts with something far more subtle and easier to dismiss. Feeling dizzy when you stand, unsteady on your feet, or having a sudden wave of nausea for no clear reason, these can all be early warning signs that your brain is in trouble. You might also feel a kind of mental fog, where your thoughts seem slower, your memory feels cloudy, or simple tasks suddenly become hard to manage. Many seniors chalk these symptoms up to dehydration, fatigue, or even aging. And while those explanations are possible, they shouldn't be your first assumption, especially if the symptoms appear suddenly or seem unusual for you. Let me give you 3 real-life examples I've seen in my practice. First, Mr. Bennett, 75, stood up from his recliner and nearly fell over. He hadn't been drinking, wasn't dehydrated, and had no history of vertigo. It turned out a clot was forming in a small vessel near his brainstem, the area that controls balance. Second, Mrs. Kim, 70, suddenly felt nauseated while watching TV. No stomach issues, no fever. Hours later, she developed a severe headache and was rushed to the hospital. That nausea was her body's early alert. And finally, Mr. Lopez, 68, an accountant, told me he couldn't remember a client's name, someone he'd worked with for over 10 years. He was sharp, detail-oriented, and rarely forgot anything. That brief moment of fog was the first sign of a small stroke that would have gone unnoticed if his wife hadn't urged him to get checked. The takeaway here is simple. If you feel unsteady, nauseated, or like your mind just isn't working right, and it happens out of the blue, don't ignore it. Don't wait to see if it gets worse. That delay could cost you your independence or your life. Stroke symptoms don't always come in big, dramatic waves. Sometimes they arrive quietly, but they're no less dangerous. Now that we've gone through all 7 signs, let's take a moment to review and talk about how you can take action starting today. Strokes don't always strike without warning. In fact, your body often speaks up weeks in advance, in small, quiet ways. You've now learned 7 of those early signs. They may seem minor at first, but for many seniors, they're the difference between recovery and regret. So don't wait. If something feels off, your energy, your speech, your vision, your balance, listen to your body and act quickly. Share this video with someone you care about. Leave a comment below. Which of these signs surprised you most? And remember to subscribe, because your health after 60 deserves nothing less than clarity, confidence, and care. And most importantly, catching these signs early gives you the power to stay in control.